Well, it has happened twice. First, he had a transient ischemic attack, a mini stroke attack they call it. Later on, he was hit with his first ischemic attack. It was when we were having dinner. My dad suddenly couldn't speak or even move.
All I could think of was, not again.
I was at work when I experienced the absolute worst headache of my life. It was terrifying.
It was a normal morning. My dad usually wakes up by 4 a.m. But when we checked on him, he didn't move, so we thought he was still sound asleep. Around 6 a.m., we checked on him again and realized he couldn't talk when we shook him. He had a slurry speech and minimal hand movement. We hoped it would pass, so we waited until 9 a.m. before finally calling for help.
My colleagues were so confused, but as soon as they noticed my slurred speech, they immediately called the ambulance.
My instinct told me something was not right, but it didn't occur to me it was a stroke.
No one around me was really sure. I am relatively healthy, so I never really thought it would happen to me.
Yes, we already suspected it because of the symptoms from the first time. Our doctor had told us that this is a warning for future strokes.
It was chaos because we didn't know where to go. We traveled for 2.5 hours to the first hospital, but had to transfer to a non-recommended hospital for treatment. So we went. Upon arrival, this was 5 p.m. They sent him straight for a CT scan, which confirmed he had an ischemic stroke. It was too late for him to receive the necessary treatment, and now he's permanently paralyzed on one side of the body.
It is important to recognize signs of stroke. Emergency treatment for ischemic stroke is best given thrombolysis within 4.5 hours.
When I arrived at the SMCV emergency department, I was semi-conscious. And I recall my blood pressure was alarmingly high. And I also recall them shouting, "Activate stroke code." And then I was unconscious.
Thankfully, because of what happened the first time, we already knew what we had to do. We had to get him to the right hospital and get him there very, very fast.
The neuro team tried their very best to stabilize him, but the damage was extensive. He was left with significant right-sided paralysis and speech difficulties.
Thrombectomy is a game changer in the treatment of acute stroke. This procedure removes blood clots in the brain that's causing a stroke, thus restoring flow to the brain. It is only effective when performed quickly.
After a hemorrhagic stroke, a craniotomy, which is a surgery through a person's skull, might be required. This is to remove the blood clot, stopping the source of bleeding, and to relieve the pressure on the brain if the area of bleeding is large enough. Most importantly, this is a life-saving surgery and aimed to prevent more injury to the brain cells.
I was in the ICU and monitored closely, but thankfully I regained consciousness a few days after surgery and was able to perform a few basic commands, although I had significant left side weakness and speech difficulties.
The application of surgical methods to treat hemorrhagic and even certain types of ischemic strokes really depends on several factors which we bring together when we decide for these patients. And these factors include patient's age, the clinical state, and from the CT scans, the location of the stroke within the brain, its volume and severity.
Being scared was an understatement, but I trusted the stroke care team would do everything they could.
And they did. Look at me.
They initiated intensive rehabilitation to help him regain as much function as possible. From here, the journey was challenging. My dad required continuous support and therapy to improve his quality of life.
My recovery was immediate. I went through a comprehensive rehabilitation process that included physical, speech, and occupational therapy. I had regular appointments with a neurosurgeon and a neurologist to prevent reoccurrence and to monitor my recovery. In 6 months, I'm proud to say that I made significant progress. I regained partial mobility and improved my speech.
Stroke care does not end in stroke unit or HDU. conventional neural rehabilitation such as physiotherapy, occupational therapy, speech therapy, together with innovative technique of non-invasive brain stimulation like RTMS, repetitive transcranial magnetic stimulation, would definitely maximize the stroke recovery pathway.
With the quick intervention and extensive post-stroke rehab, I am so grateful to say that my dad made a full recovery.
I needed to have patience. I don't like troubling my loved ones, so I was very determined. My self-discipline and support by family members, as well as care from the medical team, made a huge impact on my recovery.
Could have turned out really bad. I might not be here talking to you, like right here, right now. So listen to your body. As I've been ignoring my headache, stroke can happen to anyone, anytime. So learn the signs fast.
My biggest regret, no. Be aware, educate yourself. But beyond that, finding a hospital with a dedicated stroke team is the key. Don't waste precious time like what I did.
Take good care of your health. Always be alert.
Appreciate your family, love and support one another. That will keep you going.
Yes, the recovery journey is tremendously tough and rough, but you don't have to go through this alone.